So we've established what the coronary heart diseases might be. We've looked at arterioatherosclerosis, we've looked at angina and heart attack. So we're going to consider in this video any risk factors which might contribute to somebody suffering from coronary heart disease. We're going to look at maybe how we can prevent that, and then also look at the advantages of doing endurance training or endurance activity on the cardiovascular system. So here we've got a lot of the coronary heart disease risk factors, some which you might be familiar with or might recognise from previous work. So we're going to take these one at a time and consider how they might be a risk factor. Obviously, genetics is something you can't control. If there's a history in your family of having had some form of coronary heart disease, unfortunately, you might well be at a higher risk of suffering yourself. So it's worth knowing about family history and being mindful of that. Obesity. So obesity relates to somebody with a BMI which is larger than 30. And basically what somebody who's overweight or obese is they're carrying around non-functional weight. So it's a bit like carrying around a lot of shopping bags with you the whole time. They're of no use to you. It's just extra strain for your heart to deal with in order to make you function and to get you moving. And there are also associated conditions. So somebody who is obese is also quite likely to be hypertensive or to be suffering from diabetes. And it's a very accepted fact that there's a trend between obesity and those suffering from coronary heart disease. Here's some data up to about 2010, so relatively recent, showing the trend of children and obesities. The boys are the solid line, girls are the dotted line. And you can see that in terms of percentages, we've got, even in 2010, probably about 17% of boys who are obese in England, and that's an incredibly high proportion of young people. Here's some other data looking at the percentage of males and females, so men and women, using the different age categories. What's important here is you can note that in all of the age categories, males have a higher prevalence of being overweight or obese than females. But what you can also see is, as you age, you can often become increasingly overweight or obese. So something to think about in terms of habits that we give our young people, because the habits that they take into adulthood might well affect this. Cholesterol and blood lipids. So again, you might associate cholesterol as being a bad thing, and actually it's not always a bad thing. Blood lipids that we might have in fat circulating in our blood can be a problem. They can be very useful as an energy source. So triglyceride is actually our stored form of fat energy, and that can be transported in the blood. But obviously excessive amounts of that can certainly clog up our blood vessels. Now, cholesterol can be in a rather more negative form, which would be LDL, low density lipoproteins. Now these are not good. These are sticky forms of plaque which would stick to the walls of the blood vessels, the arteries, the coronary arteries, and gradually block them up. However, we have good cholesterol, and we need cholesterol that has an important role for us. HDLs, high density lipoproteins, are the happy cholesterol form. So high density is happy ones. They're good for us. And these actually help remove or unstick the LDLs. So LDLs are bad. HDLs are good for us, and they are very useful in doing so. So here's some visuals to try and associate with that. So LDLs, the yellow here, the bad stuff that stick to the walls and block our lumen, and the HDLs are the good form of cholesterol which try to reduce the volume of LDLs that we have circulating. So again, this shows the positive effect. More HDLs basically reduces the LDLs. So HDLs make us happy. Smoking is also another risk factor of coronary heart disease. Smokers are twice as likely to suffer from coronary heart disease. And again, you should know by now that it's the carbon monoxide which attaches to hemoglobin, reduces our oxygen transport, reduces the oxygen that will go to our brain, our body, but also our myocardium. And also it can put extra strain on our heart. It can contribute to hardening our arteries, so arteriosclerosis, and also increase the chances of blood clots. So smoking is really not good on many levels. Obviously, you can control this, so you can reduce this as being a risk factor by stopping or reducing your smoking. Hypertension, again, we know that this is related to the pressure exerted by the blood on the walls of our blood vessels and the walls of our arteries. Hypertension is a continued high level, at least 140/90 millimeters of mercury, which is related to an increased resistance in blood flow. So if you've got hardened arteries, you will not be able to have those arteries expand and recoil as they should, which will increase the resistance to blood flow, which means that you're more likely to be hypertensive. And again, if it's not easy for blood to flow through your blood vessels, there'll be extra strain on your heart, and that will also increase the chances of your cholesterol and fatty deposits being laid down in the arteries. So it becomes a vicious cycle. Here again, just to illustrate, healthy blood pressure anywhere around 120/80, but when things become high, or particularly high, 140/90, you're considered hypertensive. Stress is another coronary heart disease risk factor. So stress and the hormones that you release when you're stressed can have an effect on your heart rate. It elevates heart rate and ultimately then increases cardiac output and will therefore increase blood pressure. So stress is not going to help you. It also reduces your immune system and can affect your digestive system, so it can unsettle your stomach. But related to the cardiovascular system, stress increases heart rate and blood pressure. Diabetes and sedentary lifestyle both might be related actually, because type 2 diabetes is considered the lifestyle diabetes, something where based on your nutrition and your inactivity levels you might suffer from an inability to regulate insulin and blood sugars. And a sedentary lifestyle, obviously we know from our need and our talk already about balanced active healthy lifestyles, can obviously affect your chances of suffering from coronary heart disease. It could be that you have automated transport, you don't walk, you take the car, take the bus instead of maybe cycling. Your parents might not be active role models for you, therefore you might have quite an inactive lifestyle. You might not choose to take part in recreation physical activities, and ultimately if you are sedentary, you're inactive, and this low level of activity is really a significant risk factor. The World Health Organization says you're twice as likely to suffer from coronary heart disease if you're inactive. So given those risk factors, here are several ways in which we might be able to try to prevent coronary heart disease. We can strengthen our heart, so if we can do regular exercise, the wall of our heart will become thicker and stronger. We can reduce the fat intake that we have, then hopefully reduce the cholesterol and the bad cholesterol, the LDLs, increase our HDLs by activity levels and our nutrition, reduce our stress. Low salt intake will also help reduce blood pressure, reduce our smoking and alcohol, and all the other associated benefits relating to physical activity that we'll talk about in a moment. So being physically active and manipulating your nutritional intake can hugely affect your chances of coronary heart disease. So increasing our physical activity levels specifically can reduce the chances of angina, less chance of hypertension, less chance of a heart attack, reduce stress because we know that it can be cathartic, it will strengthen our heart muscle and increase our red blood cell production and therefore our hemoglobin production, and that means we can transport oxygen better. So regular physical activity blatantly can be an important part of a balanced, active, healthy lifestyle and reduce the chances of coronary heart disease. What type of physical activity? Well, low to moderate levels is really all you need. You don't need to do high intensity activity to be healthy, although it can be beneficial. So it could be low level jogging, swimming, cycling or walking. And we know that it should be for adults 3 to 5 times a week, about 30-minute sessions. And for children, an hour a day, basically, of moderate level activity. Higher intensity activity, however, can be of greater benefit to us, but minimally doing something will be helpful in terms of coronary heart disease. So this was a 10-mark question that came up, which might address any of the information about coronary heart diseases, so describing the diseases, and also maybe explaining how you can prevent coronary heart disease.